Hi everybody, I'm Christine Sutherland, and this is my friend Chris Takla.
Hello.
And Chris, can you tell me what kind of running you're doing and how your muscles are responding?
Yeah, for sure. So I've been running for a couple months now. I'm looking to maybe do some marathons going into the fall. Yeah.
Yay.
But as I've been kind of going out every day, I've noticed that when I wake up in the morning especially, I've got a lot of soreness in my legs, you know, calves, and also shoulders. Just from running, bouncing.
Yeah.
I'm a fairly tall guy too, so I don't know if that's kind of, you know, making it worse, you know, just the bouncing.
I'm under 5 feet, you're over 6.
Exactly. Gravity's probably holding me down a little bit harder than you, right? So.
Well, okay, so we've got legs and we've got back.
Yeah.
So why don't we start with back?
Okay, sure.
So slip off your shirt.
Absolutely.
And I'll put you here on the table. And folks, you don't have to have a fancy massage table to do this. Chris could be on a picnic table in the park by the lake. He could be on the ground. You could use a yoga mat or just put a towel down, but Chris, put your forehead here.
Absolutely.
And then why you put pillows underneath the legs and lift your ankles, Chris, is to semi-flex the legs. As long as these legs are bent like this, it takes the strain off the lower back right away. So we want to be able to do that and have it that we've got as much opportunity. So this is low, like I put them up like that. Say you're at a triathlon. The biggest problem is the legs cramping when you get them on the table. So what you want to do is have their feet, when you don't have any pillows at all, hanging off the edge. And as long as their foot is hanging off here, then they won't cramp as much. But still, the cramping is a big deal when they come off a race and they've got that exertion. So what's happening with Chris's back here? Hey, your back is well developed. You can put your arms forward, Chris, so they're on the stool there.
For sure.
And we're going to work down Chris's major muscles. So the trapezius here at the top, we're going to start. The long muscles that go down the back and give a furrow-like feeling and look to the spine are called erector spinae. They go from right down here all the way up to the base of the skull to that occipital ridge, and they're running in a furrow. That's why his spine is indented there, because these muscles on either side are really strong. I use a carminative lotion. I use the local Chinese lotion from Wings Grocery. It's called Quan Long. All my people who are runners are carrying that in their packs for after races. Right now we're working with one of the record-breaking Canadian athletes who's the runner extraordinaire, and Maddie has that in his pack. So Chris, you're going to come up smelling a bit like a peppermint. But any of those rubs, the famous ones are the kinds of things that come in tubes and you can rub them on, but it just is peppermint carminatives that are able to keep the skin thinking something exciting is going on, keeps the circulation moving. It's really a counter irritant, but anything you can do, especially if you're not in the water. If you're in the water, you can't use any of those kind of liniments because they change what happens between you and the water.
Okay, and what about people who don't have special rubs? Can they use something basic? Like,
yeah,
I know a lot of people have coconut oil.
Coconut oil is the most popular right now. Okay. And it doesn't stain, so it's really good for when you do home massages on the sheets and towels. I'm scooping the neck. I'm really working firm. I'm doing this kind of scooping. So it's a bit like a chokehold here, but you scoop that way, scoop that way. This one is pretty traditional alternate thumb kneading, and you can split it up and like this, but I tend to use an overhand-handed one where I'm overlapping, and I'm really focused on this occipital ridge. So I do a digital compression. It's kind of like little pressure points working all along the strong attachments. So I've got strong attachments here, erector spinae and trapezius. I go over towards the ear, and I've got this front one coming down the front of the neck, sternocleidomastoid. So I can get it way down here. If you're a person who does crunches, this front muscle goes from the mastoid process down to the clavicle and the sternum It is the front flexor for the head. It gets really strong and tight. The tighter your abs are, the tighter the sternocleidomastoid muscle is in the front. It can get so tight it feels like it's choking somebody. But I spread out my fingers and really reach to the front there. You can feel that, Chris?
Mm-hmm. Yeah, absolutely.
And then come back up here and focus again on the neck. Okay, I can do a one-handed fingertip kneading where I've got my other hand supporting his head, work all around, and then I go up to the top and work bilaterally. And you can see I kind of move my fingertips intermittently, and I'm kneading at the same time, so it's a circular upward pressure, plus I'm not drilling in one spot. I'm working my way towards the mastoid process, then working right to the middle back again. And then I can work like this too. Okay, so ringing is a great big sweeping stroke where even though Chris is really muscly, you can really work to wedge that, and then you can come all the way down the side of the person with this ringing stroke. This is unilateral, where I'm just on one side. Bilateral is sweeping right across, and you got to put one foot in front of the other, folks, to get a grip, and then it's easier on your lower back. So you really stride it out when you do this ringing stroke, and you do the side closest to you. This is really, really good, especially if you got the drill bit out and you've been poking away and working deep. You really want to finish with broad, superficial strokes that are going to erase those thumbprints that you're leaving on them. And the other one that's big and broad is reinforced palmar kneading. So those are really good to come after the effleurage, which was that stroke we started with. And this pressure, I want you to do it up and away from the spine. Don't do it this way because you're charging into the spine, but use your body weight. And again, this leg is forward and I'm striding forward. And Wyatt, I'll come on your side and then you can see easier. So what I'm doing here for my posture, I've got this leg up and I'm leaning onto it. So even though I'm not very big, it's still good if you're tall like Chris, you know, to be able to lean on that front leg, push off with that back leg. And my effleurages have that same stance. I really push, push. And you can go down the back and up the back from either the head or the lower back. Okay, then we're going to do alternate thumb kneading again, up and down those erector spinae muscles. And I'm going to show you how to get the spots that are going to give him the best flexibility, the most mileage, and a competitive edge. And the way you find that out is asking about where they would like you to spend your focus. So Chris, would you like lower back, mid back, upper back?
Well, you know, I noticed that after my runs and when I'm really sore, it feels like my body's holding most of the tension right along the spine.
Yeah.
And as soon as you went to massaging right by the spine there, I instantly felt relief. I feel like that's where my body holds most of the tension.
And would you say it's lower back? Upper back?
Probably like mid.
Mid, okay. And a lot of people are like that, folks. When you've got a really long back, you can feel it right here. And that's where like this big muscle sweeps down. And it looks like it's way down his back, but it's still the normal place that a trapezius. And if you can lift out your elbows for me, Chris, as though they're coming back, just hold them up. Yep, and then put your hands forward. Yep, and then come as though you're going to dive to have your hands at a point. Up, up, up.
Like
there.
this?
Yep, hold on.
Okay.
And then lift them up again. And you can see this definition here that comes down. And that is a point of insertion there. And then you've got this ridge going out here and then up into the neck. And you can drop it. So even though it looks like it's way down his back, focusing on those end points of their trapezius really gives a lot of relief. And that's what he's talking about when he says mid-back. It's actually a muscle that is running the whole upper back department. But he's feeling it right there, which is pretty traditional. Let me show you also if Chris was like in the swimming. So his latissimus dorsi. It's a big muscle, goes into here, then it sweeps down here, and it attaches there. So I do a stroke that is like pushing, and you can see I lean my entire body weight, and that might not be very much, but still, it really is a push down. And then I work his lower back and these attachments here for the quadratus lumborum, that square muscle here, plus this big latissimus dorsi. These strong attachments down here, you can really use your body weight well if you do this stride position and lean down into the lower back. So I've got the sacrum and the lumbosacral joints here, which are taking lots of weight, even though it doesn't look like there's extra weight on Chris anywhere. It's just when you've got such a long back, this is where a lot of the tension will fall, is into the lower back. Shorter backs like mine still will go out if you lift something too big, but this back is longer, it's got way more give to it. So if Chris is picking up something, there's way more opportunity for this back to go out than my short back. So these long back people, they're like giraffes, but because they are so bendy, they really have to be careful when they're doing events. So I'm always trying to get people like this to be swimmers. So this is a basic routine where you can get, for runners especially, all these attachments for the hips, the upper part of the hips here, worked out. And I'm going to show you how to be able to work those hips too, so you don't have to get undressed or down to your underwear. You can do this right on any picnic table in any park where you're doing your workouts. And again, we'll come out of any of that picky kind of stroke with a general one. Then I go for my, I call it the drill bit, but I get the knuckles out here. Is that too rough, Chris?
No, but it certainly feels like there's lots of knots in there.
Yeah, and because Chris is an editing guy at a computer, all the other times he isn't running, these muscles here are becoming more and more of a problem in this generation of sitting in front of a screen. So anything you can do to loosen this up. I just treated someone who was in her 70s, goes to the gym 5 times a week, and I was still drilling away. So it's this kind of ridge that we're using here with the knuckles. So it's not flat here, but it's right on the tips. And the thumb can go anywhere, it can tuck inside. I usually let mine fly along. But you really have to build up to this, or you'll have somebody clinging to the ceiling and they'll be resisting you, and you just have to really warn them what's coming up and then smooth it out. Smooth it out. The other one I use is a reinforced fingertip frictioning. So it's like that. It's the same thing. I'm drilling away with my one finger on top of the other, and I could do all fingers together. But reinforcing this was something I learned years ago, and it really saves your fingers. And Chris, I think there's more going on right here where I am. But that's not your mouse side, is it?
My what, sorry?
I don't think this is any mouseitis. I think you're still right-handed on your keyboard, right?
I am, yeah.
But here you can feel how tight that is.
Yeah, it feels really sensitive for sure.
And then this side doesn't have that same, and your arms are at the same level.
When you're massaging there, I can almost feel it tingling down in my hands.
Yeah. So it's always good to check in with someone when you feel like you've got something that might be unilaterally different one side to the other. So I drill and then ease it up, then go back to drilling. Also, I really recommend ice massage and being able to take an ice cube and then drill away in there, and that really helps too. And
drill with ice cube?
Yeah, yeah. Okay. The ice frictioning is really good.
And then when you're smoothing it out, do you still use the ice cube as well?
I haven't, but that's a good idea.
Okay. And I noticed, Christine, that when you started the massage, you were up in the neck, and now you're kind of working your way down shoulders.
Yeah, I always feel like this never gets enough attention.
Okay. But
especially for tall people.
Is it important when people are doing the massages at home to start at the neck and move down? Is there any technique when it comes to that?
I think that's a good question, Chris, but I don't really think that it matters. You could start at the lower back. That might, you know, relax somebody, but you've got good questions. Keep the questions coming. It'll bring out the best of me.
Absolutely.
But it's like what Chris is alluding to is when we did the arms with Chris, when we did the workout, massage after a workout, we always did like the part that hooks on to the body. So when we do the legs, the hips, we'll be doing hips first, then knees, then ankles. So it's a bit like uncorking the bottle. That's the idea that we've got going here. Okay, you can use traditional kinds of topotement and percussive strokes. This one is called loose fingertip hacking, and it's really, really good for being able to get the person feeling like they've got their circulation moving. Stiff fingertip hacking means just don't flick them, keep them stiff. And then we go into a cupping, which I was cheating and jumping ahead. Cupping has got to be really well cupped. A nice hollow sound like that, not this. No, 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 no. So if you do it flat, you won't last long. It'll just give them a whacking sound. Then we've got beating. Sounds terrible, but it feels wonderful. And you flatten the whole hand and then let the wrist go. So don't do it stiff-wristed. Let the wrist go. And then rolling to put, we've got for the last percussive topotement is called pounding. So instead of going like this, I roll it. And it's really, really good for going up and down the erector spinae. And Chris, where should I linger when I do this? Lower back, mid back, upper back?
I want to say that feels best on the upper back.
Upper back?
Near the shoulders. Yeah.
Up here?
Mm-hmm.
Okay. This is one that I use a lot when I'm doing the on-site, in-chair, in front of people's computer on the worksite massages. I find this really, really good for being able to get up on that upper trapezius. So stiff fingertip hacking like this, loose fingertip hacking, and a rolling pounding. So those are all really, really good. And we're just gonna cover up that back to conserve heat. And I'm gonna show you, I'll come around your side again, Wyatt. I'm just gonna show you about working the hips. So Chris, I'm going to be fisting. Let me know if it gets too much, okay?
Okay.
So I start with a pretty direct stroke of a kneading that's alternating one hand with the other, and a fisted, and this kind of movement. So it's like rocket away. A lot of people go that way. This way has better body dynamic because you want to be pushing away from yourself when you do that. So when you're working a triathlon ahead of time, you want to warm up the muscles before the performance, before the event, and then you really want to work the person over afterwards. And with Maddie, our local hero in track and field, with Maddie, I always teach his folks to massage ahead of the event, and then it's really important to do the massage after because we've got more events coming the next day and you want a faster recovery. So with runners like Chris, you really want to work the hips. And then I go straight for the drill bit. So this digital compression with my thumb tips is alternating, but it's a bullet biter. So you have to be careful that you're not causing them too much tension by relieving this kind of tension. And Chris, let me know when I hit a trigger point, and it'll feel like there's a spot that's distinct. Right there? Okay. So with trigger points, we're going to breathe right into that. I make sure I've got right on. Deep breath. Well, that was good. Your back adjusted spontaneously. Breathe it all the way out, Chris. So you're good on the in-breath. Yeah, push it out. So go for 4. And usually everybody, 4 breaths should get it. Like if you do 1 or 2 and the person says it's starting to diminish, hold on for a 3rd.
Yeah, it already diminished after the
Once you get it right on. If it's lingering, it means you don't have it accurately enough. And sometimes
that was another one.
That's another one? Yeah. Okay. And I'm only getting them fast because I do it all the time. And breathe deep again. And usually you can sense it. It's pretty subtle, but you can sense when that diminishes. Like for me, over the years, it's really funny. I get like an involuntary sigh. It's like, It's as though it released all the way around the room.
Yeah, that one
starting
released on the third one.
Okay, great. And then I forgot to do this. So you really munch it out. So make sure you knead it.
What are these trigger
points are it's called a neuromotor point. Every muscle has a spot that if you press it, it will cause the muscle to contract. But a lot of times when something is in spasm, it's a contraction that's not letting go. So the trigger point elicits a complete response, and then reflexly, the muscle will let go. That's the theory. And it's really great to know where these are. But as I've said, each muscle has this neuromotor point. In the hip here, there's about 16 of them, maybe 23. Up here in the scapular shoulder blade area, there's another 13 or 14. There's lots. You can't go wrong. You can hit. Any amateur can hit a few. But don't be flat-thumbed. If you're on the tip of your thumb, you'll get it.
Yeah,
so even though I've been...
For me, it's very obvious when you've hit one. I can really feel the muscle kind of seize up, almost like it's going to tickle.
Yes.
So yeah, you'll definitely know when the person's hit one.
And let me see if there's one. All of these hamstrings insert into a point that we sit on called the ischial tuberosity. Most of the time, if people have a well-padded rear end, like women have way more padding than men. But on Chris, his hamstrings are so well developed, it's really hard to get that ischial tuberosity. Have I got it, Chris? There. I kind of got it. What should I be feeling for? It feels like a bump that I'm... Oh, yeah, I think... There, I got it. Okay. And that is like a trigger point, too.
Yeah, definitely.
Okay, breathe right into that, Chris. And all the way out. Yeah, a little bit bigger on that in-breath. Make it bigger than the one before. Bigger. There you go. And out. Nice. And it's the extra oxygen that is needed, and that really helps this release. So, good. All the way out. There we go. It's starting to go now. Yeah, and another breath. Good, good, good. Great. Okay. And we'll try and get this so it doesn't sound like you have to spend all day doing the legs. But we're going down the hamstrings with that same kneading. And then we're going to go down this side. This side has an ilio, which is the ilium, the iliac crest, the pelvis. Tibial, which is the lower leg, the tibia. So it's going past here, inserting into here. This is a sinewy connective tissue structure. So it's not like a muscle, but it is a band of fascia that really has our attention. It takes the big gluteus maximus muscle and the tensor fascia lata, and they get married right about here. And then they go down and insert into here with this inelastic structure, which is really tight if you're doing nothing, like sitting all the time or just standing in a place, working in a store, or it gets tight from doing lots, too much. So there's never a good excuse for this tibialis anterior to be loose. It's always tight on everybody. So I'm really leaning on it again, and I'm pressing in. How is that, Chris?
It definitely feels tender, and I can tell mine has been getting tense probably from running.
But watch out, folks, because like it is a bullet biter. So I remember when I was going to Team Canada's training camp, this is years ago, and they took a look at how big I was, and I thought, uh-oh, I'm going to have to pull out a few trigger points and work on that iliotibial band, and then they'll bow down and I'll be fine.
And this muscle here, I notice that when I'm running and I'm starting to tire out, this is one of the ones that I feel getting sore to begin with.
So go right down here for its attachment in here. And this all on muscles feels sinewy, but you can see how that goes. And Chris, just pick up your foot a little bit. Yep, but not this part of your leg. Just your lower leg. So drop this. There you go. And all of this is sinewy all the way to there. These ones are the attachments of the hamstrings that are going into his lower leg to lift it up. And you can drop it, Chris. So even though like he's very lean and he doesn't like bulk up thick like shorter people do, this is all still where you got to be working. So again, I'm going to show you how to do it with no oil. So you can do it at the side of any track or
And when you're doing this, are you massaging more tissue and sinew, or are you massaging muscles?
It is muscle.
It's muscles.
Yeah.
Okay.
The hamstrings, there's 3 of them. They're really big. There's one that sits on top of them, but it's really important. Knees, knees, knees. So here I'll be able to get some goop on Chris, and again I start with the ringing wire like this, and then I'll do that same scooping we did at the neck, and we'll be able to again bridge like we did between the head and the shoulders, between the lower leg and the thigh, and we want to scoop, and then we want to alternate thumb knead, again working all those attachments, and especially these attachments here. So this looks like a really picky stroke, you know, using your fingertip kneading on where this one attaches in here and the other side, but boy does it make a difference to performance. Like I swim in the lake every morning. I had a wetsuit on this morning that was horrible. It was way too much for me, and I'm used to swimming without a wetsuit. So my legs were just having a terrible time. And when I got a massage afterwards, all of the pain in my lower leg disappeared, and she worked all along these attachments. So whatever stroke you're doing, breaststroke, kicking, running, any of those sprinting kinds of things you're doing in soccer, it's knees, knees, knees. You've really got to get all these attachments.
Right, so when you're working on someone who's been running, kind of like how you mentioned it's important to get like the shoulder, because that's where the arm connects.
Yeah.
Is it really important to get like around the kneecap where everything's kind of connecting?
Exactly.
That's where you want to spend your extra time?
Lots of time, yeah.
Okay.
You can never do too much on people's knees, folks. Just think knees, knees, knees. And they're so easy to get at. When people came off our MS bike ride the other day, I had all the volunteers just have those riders sit down on a bench, and all we did was work in front of them on their knees. And it really, really helped how they were able to walk after that ride. So again, I go like this. You can get fancy also. Let me show you some of the things I do here, Wyatt. Okay, drop that over my shoulder so that this is where this muscle, the gastrocnemius, attaches into this heel, the Achilles tendon, and I use my fingers like this. And this calf muscle is split. It's a bivalve muscle. It looks like these are heart-shaped, like up like this and out. And it's a lovely muscle. It's one of my favorites. And you can get right in the center of it there. And then look at how I come back. I can interlock and I can knead it back together. So it's a bit like, let's take it apart like this and just groove in and check with your partner like I'm not doing. How is that, Chris?
Yeah, pressure is good. It feels great.
Okay, now you wouldn't do this on your Zoomer athletes, like people my age who had, so if you think 68-year-olds or anybody over 60, if there's a history of varicose veins, phlebitis, stuff like that, check it out. But usually you can see that, and you can see any of the venule, the little blue webbing that they'll have, but you couldn't do this kind of thing.
Why would it like stretch out?
Varicosities are troublemakers. They're valves that have been blown, and so there's tendencies for clotting. There's all sorts of slowdown, you know, that happens there. Drop here. Thank you. And you can do this at various levels, but the other thing I do here, Wyatt, I go back and forth. So besides doing that kneading thing, this tends to be more my favorite. And then I can open it up and do an open C. And then I do a lot of standing stuff, and I'll do this. I mean, it looks so simple. Ah, it feels so wonderful. Mm-hmm. So you just go up and down and get rid of the sock. So this, that. So it's a bit like, unless they're really hairy and you're pulling the hair. Sorry, I didn't check on that. But I'll get a little bit more goop there. So I've got more lubricant for not irritating his hair follicles. If you make a mistake, it's this. Being on a hairy leg with and rubbing back and forth, that's it. They can't be massaged after that because you've irritated that hair follicle. And remember, everybody, pressure towards the heart, whether it's feet, anything in the lower extremity or upper extremity, those valves want to open up towards the heart. You don't want to push down because they don't like it, and these valves tend to break, especially if the people are genetically predisposed to circulatory problems. So, and I'll get in the way here. What? So if your mom or dad ever had varicose veins, then be sure and use cold water. So when you come out of a race, go in the cold lake, get out of the cold lake, rub your legs, get in the cold lake, get out of the cold lake. And what does that do? It's a vascular flush, okay. So it's really, really healthy, especially for weak circulations. So lots of people love to run, but they don't have the circulation for it, but they're going to run anyway. So it's how to get around those kinds of contraindications and still give them a benefit so that they can keep massaging and they can get ready for that next race. So remember, everybody, hips first, knees, 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 big focus. Don't forget the feet because they're working hard. Transverse arch, especially, you saw me working that with Chris, and into these heels. They feel like they don't feel anything, but actually they feel lots. So there you go. And again, watch this for a finale. Loose fingertip hacking all the way down. Stiff fingertip hacking, following the loose, cupping. Pounding gets a lot of good mileage right on the heel, heel to heel. And then you can do the beating. My favorites tend to be the loose fingertip hacking and the cupping and the pounding, especially right here. Just give this side a little go over so it doesn't feel left out, Chris. And if you only had time for one leg because there was a problem, just do a squeeze down the other leg. It's amazing how fast the nervous system likes that and helps balance things out, just so they aren't limping out. You want them limping the right way. How does that feel, Chris?
Feels great.
Great.
Yeah, just that little bit of squeezing that you did on the one leg makes them feel both very relieved and equal.
Yep.
Whereas beforehand, this one felt a lot heavier.
And Chris isn't a professional runner. He's an amateur runner, a lifestyle runner. Those are the people that don't tend to get into as much trouble as our competitive runners. So take anything that we've done here in the everyday, this is you runner department and apply the sports massage principles. Remember, if you can warm up and do a rub down really fast all over the legs and arms before they start, perfect. Use your Epsom salt baths for between races. Put tons of Epsom salt in. It'll draw out the lactic acid if you don't have any massages going on. Just grab whoever brought you to the race. Moms, dads are really good at this kind of thing. So thank you for joining Chris and I and learning how to rub your everyday athlete the right way.